Hello, I'm Ford Gilbert, and I helped develop the artificial pancreas treatment. And specifically, we started with type 1 diabetic people because type 1 is the most severe type of diabetes. Type 1 is characterized by patients not making any insulin at all. There are a few who have residual pancreatic insulin production, but very few. And type 1 is where your body, through its autoimmune system, wipes out, we call it through phagocytosis, it literally kills off your own beta cells, which are the cells that make insulin. So when we started with type 1 because those were the most needful patients, and indeed Trina was one of those patients. Now type 1 diabetes is particularly receptive to this type of treatment because what we do is we mimic a normal pancreas. That's why we call it the artificial pancreas treatment. Because a normal pancreas has a very specific signal to the liver and the rest of the body that allows the body to burn, that is, metabolize carbohydrates. So when you see that extra blood sugar, what you're really looking at is just a symptom. It's a symptom of the sugar that wasn't processed properly by a diabetic person. That's also true of type 2, but it's most obviously true of type 1s. Now, we work very well with type 1 patients because when we restore the ability to process carbohydrates properly, that allows these patients to store glycogen in their liver. In other words, type 1 diabetic people don't store glycogen in their liver very well, and our patients do. And when you store glucose into the liver, it helps to buffer the blood sugar. And of course, we don't want our patients to be going very high or very low, especially hypoglycemia is particularly problematic for type 1 diabetic people. So our treatment is very effective because what we do is we restore the processing of carbohydrates. Now, as to outcomes, that's very important because diabetes is one of these horrible diseases that attacks you all over your body. So there is no process of a body that isn't adversely affected by diabetes. Why is that? Because every part of your body needs to burn, in part, some glucose, some carbohydrates. We were made to be able to eat vegetables and process them properly. We were made to process sugar properly. Diabetic people don't do that. Now, why don't they do that? Because their body doesn't know that they have carbohydrates. It's the job of the pancreas to signal the body, and particularly the liver, that it is time to eat carbohydrates. And so the bottom line is that carbohydrate metabolism restoration is going to always help every part of the body. Now, your cells have a perfect memory that God put in there called DNA. And every cell knows how to metabolize properly if given enough energy. What we do is when we restore carbohydrate metabolism, you have a lot more energy in those cells. This is particularly true of diabetic people who have even less energy than type 2, or I should have said particularly true of type 1s because they have less energy than type 2s. So we restore that energy component that's missing, and when we do, we attack the core problem of diabetes. So the core problem of diabetes is not your blood sugar, it's the inability to metabolize carbohydrates properly, and that's what we attack, and we attack it by mimicking the way man's own pancreas was designed to operate. So it's really exciting. Diabetic people, especially type 1s who are very, very infirm by this horrible disease, can see a restoration of virtually every aspect of their body. It turns out that we can reverse, and almost always do reverse, neuropathy. We will help the heart to burn carbohydrates properly, which is what it wants to do. We'll do all kinds of things with the nerves. We'll help wounds to heal. We stop the progression of diabetic-related nephropathy, in other words, kidney disease. And we have lovely studies on all of these things. So even though at first when we started this whole process, I never expected this treatment to work on type 2s, it turns out that type 2s are just like type 1s. They don't burn carbohydrates either, but they don't burn them for a slightly different reason. But the reality is that the signal that the pancreas is supposed to give to the liver and the rest of the body for a type 1 is missing, and for a type 2 it's missing also. That's why this treatment actually treats both type 1 and type 2 patients. Although I have to admit, when I first started, I had no idea that that was going to be the case. A lot of what has happened in this whole thing is a little bit surprising, but we really did underestimate the ability of DNA to repair when it had sufficient energy, that is ATP, so that would allow the body to restore itself. So we're very happy. We have to be honest about it. We're very surprised. This is a very effective treatment. And for type 1s, it's the only thing you need almost as much as you need insulin, because type 1 people are being attacked terribly. Type 2 are too, but with type 1s, it seems like we have to treat them more frequently and more aggressively to overcome the natural problems of type 1 diabetes. So thank you very much. It's exciting as it can be. And if you are a type 1 diabetic, this is really good news. Thanks.